to you all, or good morning to those who are zooming in from different time zones. Thank you very much for joining us today on our newest installation of our TalkXX series. Uh, since our last event, coupled with new projects, a series of new projects, our reach has continued to grow and our initiative has expanded to a wider audience. And this change is exactly what has brought all of us together today. Our event today will focus on a topic that is often discounted, misinterpreted, or any of the above. And that is to do with male reproductive health, male hygiene, all tied into well-being for men in general. And along the way, we will also be busting a few myths and going through a little bit of debate of what is the truth and what is something that has been misinterpreted in the past. So, with that said, I'm very excited to introduce our special guest today who will become the voice of our organization for the next 40 minutes. His name is Dr. Bautista. He is a licensed doctor of medicine with experience in biochemistry, occupational medicine, and physiology for the last 12 years, and he is currently the head of the Department of Physiology at Emilio Aguinaldo College of Medicine in the Philippines. So without giving too much away of what he will be covering, I will let Dr. Bautista take the floor, formally introduce himself, and get started.
Thank you. Thank you very much, Sam. Nice meeting you. I would like to
Same
thank
here.
Project X for having me today with this very interesting talk. Thank you very much. And good evening and good morning for those who are in their different countries that are listening to us today. Our topic is quite interesting because it what do you call this? It tries to tap on different aspects on male reproductive health in general. Okay. So can, can we start? And should I share my screen?
Yes, go ahead, whenever you're
Okay.
ready.
Thank you. Okay.
Yeah.
So so this evening, would like to talk about male reproductive health. In general, this is divided into three aspects: formation of our sperms, which we call as spermatogenesis, and then a male sexual act. And we'll try to tap on several diseases or several interesting mythbusters that are misconceptions in spermatogenesis. I always instruct or I always tell my students, especially the male students, that they are millionaires when it comes to sperms because we produce at least several millions per day. So each day in our lives, we produce several millions of sperm at around at least to 5 millions per day. So if you can, per hour, I mean, so it can regenerate in our body at least a billion times in a day. So we can regenerate those sperms a billion times in a day. But if you think of it, it's too much, doctor, in a day. Please take note that we can ejaculate at least between 15 million to 200 million per ejaculation. Okay, and we have special hormones and special signaling in our body that can suppress it, can increase it, which I will try to cover by this discussion. Now, this spermatogenesis begins at the age of 13 years old for the male. That's why when we were kids, I always joke around in our class that the male gender, especially when we are younger at around 10, 9, 8, 7, 6 years of age, we all look like females and we are cute, right? We have chubby cheeks, our voice are cute and high pitch by that time. But the mean age of 13, our brain recognized that we're already in our adulthood or proceeding to our adulthood. It begins to secrete a special hormone, which we call your gonadotropin releasing hormones, which is a beginning of the signal in our body to produce testosterone and to begin the spermatogenesis in general. Okay, that's why in 13, we start liking girls. Before, for the male gender, when you consider kissing a 10-year-old kid in the cheeks, they will say, ooh, girls, ew. But when they reach at a certain age, at 13, 14, 15, they look at the female gender differently already. Okay, so it all begins or it happens in our testes. So these are a seminiferous tubules that are coiled inside our testes that is responsible for formation of our sperms for reproduction. Now, this has several signals, as what I mentioned before. After our gonadotropin releasing hormone goes to our pituitary, and then the pituitary will now secrete your follicular stimulating hormones and luteinizing hormones, and it will stimulate several cells inside our testes. Okay. Now, as I mentioned, it takes several organs in the male body to produce this type of uh, signaling and production of our sperms. First is in our brain or cortex, which sends signals to our anterior pituitary, particularly your gonadotropin releasing hormone. But what's important to note, Sam, that it coincides with the increase of the growth hormone in our body. That's why it begins at around the age of 13. Now, in the anterior pituitary, we have your follicular stimulating hormone and luteinizing hormone to stimulate our testes, particularly the interstitial cells of Leydig, which begins to secrete our testosterone, the male hormone. Okay, but there's a special cell that helps in the formation of our sperms that gives nutrients to our sperms, which we call your Sertoli cells or nursing cells, properly named because they're nursing our spermatogonium. It takes around 76 to 72 days to form a completely formed sperm. But as what I mentioned before, we are billionaires or millionaires when it comes to our sperm. So it doesn't matter if we have 3 months in production or just a few days in production of those sperms, right? This rapidly inclines when we reach from 13 to 17 years old, as previously mentioned. So I want to show you this chart to answer some of the mythbusters that we will discuss later. Because for us males, for the male gender, as you can see, when we are inside the womb of the mother or still a fetus, and we have that XY gene from our father and mother, it signals our placenta to secrete, or it acts like a signaling to our body that we should secrete testosterone and become the male gender. After we are born, in a few months, in a few weeks, there's an increase of this testosterone in our body. But I would like to uh, you to concentrate or take notice at the age of 1 to 10 years old. That's what I previously mentioned. There is a period in our human body that we do not secrete that testosterone. Hence, male male babies or male child are very cute, that's what I said, and they look like a female. But if you can see the red line in this chart again, at the age of 13, going to the 17, 18 years old, those signaling or the production of testosterone greatly increase in our body. That's the time that you will have a different voice, a larger voice for the male, and they will have an increased body mass, they will have an increased metabolism, and sometimes because of these hormones also, they will develop different acne in their skin, and they're wondering where the other hairs coming out from in the different parts of their body. Okay, and the blue line represents the production of our sperms. So at the age of 13 or 14 to the 17 years of age, together with testosterone, it rapidly increases also. So that's why at the teenage years for the males, they can sometimes have nocturnal emissions, they will have wet dreams, and they have raging hormones when it comes to their sexuality. So that's one of the basic physiologic reasons for the male having their changes in their teenage years. But I also want you to take notice in our adulthood when it comes to around 20s, 30s, and 40s, it goes into a plateau at the high rate of that secretions of hormones and production of that sperm. When you reach a certain age around 60, it rapidly declines or it declines a little bit at around 25%. But if you can see the blue line, it's still up there at around 70 or 80. That's why the male can still produce the sperm at around that age. We're talking about a very healthy male, or there are no disease entity in his body. On the right side of the picture, even though we are millionaires, we can sometimes produce what we call your abnormal looking sperm or infertile sperm. That's why sometimes, even though we ejaculate those millions of sperms, only a few of them can reach the female ovum and impregnate a woman or the egg of the female. Okay, so that's the chart. Now, this sperm has to be nourished or capacitized. We call it in physiology as capacitation to put any padding or put any other chemicals and nutrients before it goes to the vagina or to the female reproductive tract. Because if you have to remember, this sperms has to swim to the vagina, cervix, uterus, fallopian tube in order to impregnate the egg of the woman. So it has to have some sort of protection in going through that acidic environment, or what we call it as a harsh environment, because the vagina and the cervix or the female reproductive tract that is very selective on which it wants those sperms to enter. Okay, that's why I also joke around when I do this in class that for every student of mine, please you consider yourself as millionaires or as winners because we are the sperm that impregnate the egg, and we are successful out of the millions of sperm that our father has ejaculated. So we came out into this world as millionaires, and winners. Okay. So what's the traveling point of that sperm after we produced it? As what I mentioned, it was produced in the seminiferous tubules. It is stored in our epididymis, a portion posterior to our testis. In this area, Sam, it is where the sperm learns how to swim, or this is one of the storage area of our sperm when we are producing it. And then it goes up and behind our urinary bladder to what we call a tube of vas deferens and ductus deferens. It is joined by a very special gland that gives protection, fructose, citric acid, and other important chemicals like prostaglandin for the sperm to survive inside the female genital tract, which is your seminal vesicles. Okay, the ejaculation of a male, the ejaculatory product of the male, 60% of that comes from the seminal vesicle because of the protective mechanism or protective juices that it secretes together with the sperms. After that, it is now transferred to the ejaculatory duct, which will be piercing our prostate gland. The prostate gland for the male gives it an alkaline substance so it can survive the acidic environment of the female reproductive tract. That prostate is also the one responsible for the milky appearance or whitey appearance of our ejaculation. And then after that, it will now be transferred to the prostatic and membranous urethra and eventually will go out to the penile urethra or the penis of the male. Okay, so that's the pathway. As you can see, it's very intricate. It has many protective mechanism and substances and enzymes that it has to go through before we ejaculate that sperm. So usually, when it comes to male reproductive health, we try to investigate or try to do a physical exam on the pathway of the sperm in order to see if the male is infertile or not, or any other disease entity that can cause infertility for the male. Okay, so those are the pathways for our sperm. Now, this is a side view of it, so everybody can see and imagine how it goes from the scrotum. You can see the epididymis, and it goes anterior and posterior from that vas deferens or ductus deferens. And at the side near the rectum, it will be joined by your seminal vesicle. They call it your accessory gland, but that accessory gland gives protection for our semen and your prostate as well. That is one organ that helps the alkalinity, as what I mentioned, and the milky appearance from it. We have a common urethra for the male. It passes through the ejaculatory duct and it joins now your prostatic urethra. So before it leaves, there's a special organ that lubricates. You might be wondering, doctor, the semen and the urine has a common pathway. So shouldn't our urine kill our sperms because of the acidity of our urine? Luckily for the male, we have what we call your Cowper's gland or the bulbourethral gland. That is a mucus secreting gland that helps wash us away our urine and keeps a clear path for our semen before we ejaculate to the female. So by that alone, it is also helping or aiding the transfer of the sperm going out and into the female body. Now, your bulbourethral gland, sometimes there's a misconception that it's the one they call as your precum. But actually, in a healthy male, that bulbourethral gland is also contracted the same way or that the seminal vesicle is contracted when we ejaculate and we have an orgasm. Okay, so as you can see, we share a common urethra from the prostatic, your membranous urethra, and your penile urethra. Now, for an erection to occur for a male, I chose this picture, Sam, because there are multiple factors for a male to have an erection. First, our penis is made up of, you can see it in the center, it's made of a erectile tissue, your corpus cavernosa, which has a artery inside, which we call as your deep artery, which supplies blood. So when it's being supplied by blood, it will elongate and it will hold that blood so we can achieve an erection. On the left side of the picture is the blood supply of our reproductive organ, which comes from our internal pudendal artery. Now, those blood supply that will go to our penis helps in our erection and maintain that erection during sexual intercourse. But as what I've said, there's also a nerve innervation that has to come into play for us to achieve an erection. That is our autonomics, which is your parasympathetic and sympathetic. Sorry to be technical about it, but it comes from our sacral region or near our butt or pelvic area. So why am I emphasizing on this? It's because those people that have a car accident or any accident in their pelvic area that they can lose their innervation, sometimes they will have difficulty in achieving an erection. Now also, as you can see from the left side, since I mentioned our erection is because of the blood supply going to the penis, this is mainly true for those people that has cardiovascular diseases. They will also have a problem in achieving an erection. So there's plenty of what do you call this aspects or how do I put this? Plenty of factors that come in for a male to achieve an erection. Okay, we have the vasogenic or the blood supply. It can be nerve innervation by our sacral nerves and even our brain. And of course, our endocrine, as I mentioned before, and metabolism as a male in the hormones. Okay, so in a male sexual act, the stages of the male sexual act is defined into this six uh, factors. We have to have to achieve penile erection. Second, we have that lubrication, but which I mentioned a while ago about the bulbourethral gland or Cowper's gland. We will also have to have that emission. Emission is defined as the secretions of those seminal vesicles, prostate gland, and the bulbourethral gland as well. And then the ejaculation is defined as we uh, put out that sperm that we just produce in our body. Orgasm is the sexual satisfaction. And resolution, as that blood flow goes back to our body from the penis now will become flaccid or decrease in size. Okay, so those are the stages of our male sexual act. Now, some males cannot achieve erection or has problems in having an erection, which we call as your erectile dysfunction diseases. This is defined by WHO as a consistent or recurrent inability to attain and maintain erection sufficient for sexual satisfaction. So that's the proper definition of erectile dysfunction. That's why I always tell my med students that when they want to do a physical exam for impotence or erectile dysfunction, you have to take into consideration the sexual partner of that male. Because from the definition, they can achieve an erection, but the female is not satisfied. That also falls into the WHO category of erectile dysfunction. So this is not considered as a normal part of aging. If you ask a healthy 60-year-old male or 70-year-old male that is very healthy, exercising, no vices, he can still achieve erectile erection. Okay? So 52% of the male population by the WH data will have this disease at around age 40 to 70, which the highest rate is around 50 to 59 years old. Uh, this disease entity also, Sam, is increased in risk if the male has diabetes, is obese, has frequent urinary tract infections, or symptoms secondary to your benign prostatic hyperplasia, or they have a problem with their prostate gland. This is also correlated with patients that have high cholesterol level and low good cholesterol level. Okay, and sometimes with also with autoimmune diseases like rheumatoid arthritis. Now, for our listeners there, I always tell this to my med students. Cardiovascular diseases and erectile dysfunction share the same etiology and pathophysiology, because that's what I showed you a while ago. Blood supply is very important for the male to achieve an erection. Okay, so cardiovascular diseases, most of the patients or male patients that have cardiovascular diseases will develop in some time in their course entity of that disease an erectile dysfunction. And males that has an erectile dysfunction, sometimes in their course of that disease, will have their cardiovascular problem. Okay, it goes both ways and they share the same etiology or disease entity. Now, as what I mentioned, it has a pathophysiology wherein there's a failure to initiate that erection, which it can be due to psychogenic problems. When the male has a marital problem, he lost his job, always in stress, any factors that affects his mental health can contribute to erectile dysfunction. Endocrinology, which we tackled a while ago about your growth hormone, thyroid hormone, even your anterior pituitary, can contribute to the factors of erectile dysfunction. And neurogenic, when you talk about neurogenic, that is your problems in your neurons or spines or your nervous system. Now, failure to fill, for us to have an erection, as what I mentioned a while ago, there should be sufficient blood flow, a good blood flow to the penis. There's also failure to store that adequate blood wherein it leaks out so that they cannot maintain that erection for quite some long time. Now, these categories are not mutually exclusive. Sometimes they happen in multiple categories at the same time for the male. That's what I mentioned a while ago. Diabetic and atherosclerotic and sometimes drug-related causes accounts for more than 80% of erectile dysfunction in older male. So for easily to remember of our audience, disorders like vascogenic, neurologenic, psychogenic, and endocrinologic diseases can contribute to erectile dysfunction of the male. Okay, so I think I tried to cover more of the male reproductive health, or I think that's my last slide for it. Any any questions that I can answer for our audience and everybody listening?
Sure, yeah, we actually have a list of questions that are ready for you to go, but I wanted to ask you whether you want to
Sure.
cover the Mythbusters first or the questions first.
Let's go with Mythbusters first.
Sure, we'll make it a little bit exciting for everybody here.
Yeah, sure, sure.
Awesome. Okay, so there's five Mythbusters that are super common, I imagine, that are either
Hmm.
misinterpreted or misunderstood. So the first one is that for maximum fertility, men should wear boxers instead of briefs.
Okay.
I
for maximum fertility. Okay, so when we talk about fertility, as what I mentioned a while ago, it has different aspects. But for boxers and shorts, for the males, uh, it has both its advantages and disadvantages. What do I mean? Uh, when you are resting and not doing any physical activity like sports, basketball, or any contact sports, probably you can wear your boxers to help your blood flow and make your reproductive organ relax. But if you're engaging in sports and you have your boxers and somebody accidentally pushes you or knee you in your groin area and you have no protection around there, that would be problematic for the male. So for the question or the myth that boxers and briefs play an important role, I would answer that depending on the activity of the male. If you're an athlete, probably I will recommend wearing briefs more. But if you're into casual and you don't engage much into the contact sport, you would greatly help your reproductive area by wearing
So I
boxers
guess
rather than
there is
briefs.
some truth to it, but it just depends on the
Mhm.
functionality.
Person, yes, on what's the lifestyle of the male.
Uh-huh.
But as you learned a while ago, there are plenty of factors to play on it. If uh, you're just resting, even if you're an athlete, probably I would recommend that you wear boxers so that your blood supply in your penile area or scrotal area won't be compromised when you're resting. So there's a little bit of truth, but it depends on the lifestyle of the male.
Right. So I guess it's a little bit true, but it depends on the functionality and what sort of
Correct.
activity is at hand.
How you doing?
Okay, okay.
Yes.
Got it. The second one is a little bit interesting. Uh, it's a little bit interesting. So it says cell phones and laptops don't affect semen quality.
Uh, that myth is that's the first time that I heard about myth. I don't know if the seaman is making a call or using the laptop, Sam. Is there a factor there
Right.
where the seaman is what do you call this? Calling somebody or using the laptop? No, there's no truth on that. For the radiation, and if they're worried about that, as what I mentioned, we're millionaires when it comes to the sperms. So and it will take days, then they can regenerate it again. But the most
Mhm.
harm that a cell phone or laptop that they can do if you put it directly to the testicular area of the male is to produce heat and can at least burn the skin of the male reproductive organ. But otherwise, there's no truth to that.
Okay.
Unless
Okay. Yeah.
the sperm is calling somebody or the sperm is or our
Mm.
reproductive organ is doing something with the
Mhm.
laptop.
Right. Right. Okay. The third one, it says sperm production and quality or fertility remains constant with age. And I know
Yeah,
you covered a little bit of this in the presentation.
correct. Yes, thank you. We're talking about a healthy male, right?
Mhm.
If we are physically healthy on all aspects that I mentioned a while ago, it should not affect our sperm production until we reach at around the mean age of 60 to 70 years old. So there's some guys that are at that age that are very healthy that they can still impregnate a woman at around that age. But as you know, the male body begins to decline at around age of 40, 50, 60s, and they have certain vices that they do, which affects their health, blood, blood flow, vascogenic, neurogenic, and the stress of working plays a factor also in their sperm production and hormonal production. So yeah, I think I covered that a while ago. Hopefully, they understood it at around if they're healthy, which we encourage the guys here to be healthy at around that age, they can still have babies at around age 70 or 60s.
Right. Yeah, even I have heard this myth a lot throughout my human growth and development classes that I had in school. So I just wanted to make it a little bit more
Sure.
clear and ask everybody, that this is fact and this is the myth. So,
Yeah, correct.
yeah, right. The fourth one says masturbating too much is bad for health.
Okay. I would like to ask first. I usually I encounter this question regarding masturbation every time with my patients. Doctor, is masturbating too much hazardous for my health, or does it affect my health very much? But my first question to them is always, what is too much for you? What's the quantitative number? Which is too much? Is twice a day, 3 times a day, 4 times a day too much to you, or 7 times a day? Now, physiologically wise, if they do it every day, there's no problem with it. I bet some guys do it every day or more than once a day. It doesn't affect their health. But as what I mentioned a while ago in our discussion, as you can see, most of the hormones are coming from different parts of our body, from our brain to our anterior pituitary, it goes to our scrotum. You can deplete it in a day if you masturbate probably more than 10 times or 11 times a day. It gives you exhaustion because the hormones now are being stimulated and being triggered by your masturbation. But regularly, probably not. It's not affecting, or it can be good as some doctors would recommend. But again, for those who are not masturbating or not releasing at all, I just want to emphasize that we have a special hormone which we call as inhibin that can signal our brain that there's already too much production of our sperm and that we should decline in the secretions of those hormones. So it acts like a negative feedback in our body. Those happens for those people that what we call this choose to live a celibate life, right? They don't want to masturbate. They don't engage in sex. So for those type of persons or male, they have a special hormone that are secreted by their testes, which particularly your Sertoli cells, which goes to our brain, anterior pituitary, and tells us, wait, we are not ejaculating or we are not engaging in sex. So can you decrease the production? And our body will now try to decrease that hormone and try to suppress the sperm production. But for if we go to the other side, if we masturbate too much, the storage of the sperm in the epididymis can decline greatly. But as what I mentioned before, we are millionaires and billionaires when it comes to sperm. Probably we can regenerate it again. The only problem that I always encounter with my patient is that they masturbate too much and they want to impregnate their partner, their female partners, right? I would advise them to abstain for a while, especially during the ovulation period of the female, for the male to get their wives pregnant. So masturbating too much depends on what's the definition of too much, but we have fail-safe mechanism in our body to help us suppress it. At the same time, as what I mentioned, we can regenerate it every minute, every hour, every day, and every week. You can deplete it, but hopefully, if you're healthy enough, you can regenerate it as well. So there's no problem with it. So that's my answer to that, or that's my medical opinion to that.
Interesting. Yeah, it's always interesting to see. We've heard about how the body is considered a correcting mechanism or a self-correcting mechanism. So it's always
Correct.
interesting to see examples of that. So I learned
Mhm.
something new there. Thank you for explaining that in depth.
Welcome,
Uh,
welcome. You're
the
very much
fifth
welcome.
one, the fifth and the last one, it's a little bit different from what we've been talking previously, but it covers
Sure.
circumcision, and it says that
Okay.
circumcision is a personal preference or a ritual in some religions.
Okay. A circumcised male versus a circumcised, uncircumcised male. When it comes to fertility, it doesn't affect, or it doesn't have any factors that can affect the male fertility. Because as you see from our discussion a while ago, the sperm production happens in our testicular area. So it doesn't play any factor. Does it play a factor when it comes to intercourse? There is also no factor because that pubis or that extra skin from the head of the penis of the male will also be retracted once it penetrates the vaginal canal. So there's no factor there. The only factor that it can be uh, disadvantage to the male is that when it comes to hygiene, it is more difficult to clean a penis that is uncircumcised versus a penis that is circumcised. So that's the only disadvantage. But if the male is very hygienic, he always washes it there, he keeps it clean, there is no disadvantage for that uncircumcised male. Now, that is the medical fact when it comes to circumcision and uncircumcised male. But it is also being attributed to religious practices, right, and tradition. But if you come to think of it medically, both fertility, erection, performance in the sexual intercourse, there's no disadvantage for the uncircumcised male. The only thing that it can be a disadvantage when it comes to hygiene because it's difficult to clean it every time that we urinate. Some of our urine can be stuck there, or if the male is an hygienic and he doesn't retract the pubis of that skin and he forgets to clean the head of the penis, it will be more prone for infection. So that's the only disadvantage for the uncircumcised male.
Right. So medically speaking, since you brought that
Mhm.
word up when you were talking about this, do you know if doctors recommend circumcision or not?
There's
Like,
one thing doctors that are very respectful of is the religious practices of our patients. I
right.
always also try to educate my med students that you have to respect the religious practice of your patients. And if culturally in their religion they don't allow circumcision, you have to respect that. But you have to educate your patient to clean it every time because it can be a source of infection for the male, especially after intercourse or even after urinating. But uh, for other factors, there's no disadvantage when it comes to sex or fertility. So I tell them respect what's their religious and culture preference, but make sure that you educate them when it comes to circumcision and uncircumcision. So that's it.
Right. That's really good to hear. So it's always important to maintain a
Yeah,
balanced point of view as a professional.
we
Right.
we always try to respect the religious practices of the different patients that come to our clinic and becomes our friend. So if they prefer their children to be circumcised, uh, we do circumcision. But if they don't prefer it to religious practices or culture, we respect that, and then we ask them and educate them that they have to maintain it clean for hygiene every time that they urinate or do sexual intercourse for it. So that's it.
Got it. That
But
was
if you
very,
ask me, my yeah,
yeah, go
sorry.
ahead, go ahead.
The second question that I usually get from my patients are when is the proper time to circumcise the male, right? I answer that always at the age of where the hormones are beginning to uh, boost up or rapidly increase, which is around 12 to 13 years old. So the proper age for me, in my medical opinion, is I coincided with the surge of that hormones in that male. So I circumcised it at around age of 12 to 13 years old. Because
Got
there are
it.
instances medically that we circumcise early, that pubis can go back if it's not done properly. So that's my second or follow-up answer to that.
Yeah, that was really informative, and I hope everybody got a lot out of that MythBuster uh, debate or a little talk that we had about it because I know that this is a topic, as I mentioned previously, a lot of it is left unsaid, so people begin to assume a lot of things. So I hope that that MythBusters and the following Q&A sessions that the session that we'll be having now will clear up a lot of misconception for all of the audience who's watching today. Doctor, if you don't mind, we can move on to the Q&A session.
Sure.
Awesome. Okay, so the first question that we've gotten is it normal to just not have an erection sometimes when one thinks that he would? or should a doctor be consulted? So I guess this is just when to get an opinion. What should I be
Okay.
scared? I guess.
Okay. If it happens only one time, probably not. You have to investigate what are the factors that came into play. Like, are you stressed, tired, or is there any uh, factors that affect you during that uh, sexual intercourse wherein you should have that erection or not? If it happens frequently, I do advise that you see a medical doctor for that problem. We will check the different areas in your body, what causes that failure in erection. But as I mentioned a while ago in the lecture part, there are several uh, signals that has to come to into play before we achieve an erection. There's a autonomics side of it in the nerves. You have to be relaxed because if you're tense, the parasympathetic innervation in our sacral region won't come into play. So if you are the thing is, some males have trauma or fear when it comes to performing this sexual act. So they're very tense, Sam. When they're very tense and stressed, they fail to have an erection, right? But if they're masturbating and they're relaxed and they're in their own room, they can have an erection. So it means that there's several factors that you have to just investigate uh, what's happening. Okay, but if it happens frequently, I do advise that you consult a doctor at least, or ask a friend, or ask Dr. Bautista.
Awesome. You heard it here, everybody. First, if you have any questions, reach out to Dr. Bautista. So I guess a good follow-up question to that is,
Mhm.
since you mentioned getting a second opinion or getting a doctor's opinion,
Mhm.
so men usually don't get a routine checkup done like women when they go to the OBGYN. So how important would you say it is to get regular checkups for men, either if it means going to their physician or to a urologist?
Okay. I frequently joke around with my dentistry students that dentist requires their patient to come to them for cleaning of their tooth two times a year, right? But mostly males or even females does not come to their OBGYN or to their urologist or even to their general practitioner doctors just for checkup. So I do encourage it, Sam, at least once or twice a year, just to visit, even if you're healthy, just to do a physical routine exam on them, especially if they're already working and they encounter different problems and they have familiar problems as well or health issues. I encourage you to visit your doctors, even if it's not the specialist, have your reproductive organs checked, even if you're feeling healthy at least once a year. Even in this pandemic, we do now virtual consultations, right? I know it's very hard, but just talking and asking questions. That's why I said to Project X, I want to help out those people or reach out to those people that has questions when it comes to their reproductive health.
Asking questions is always important.
Correct. Don't be shy in asking questions.
Right, right. Oh, great. Okay, awesome. The third question says, are there any pills or other forms of medication to avoid or stop erection for a certain amount of time?
Okay. Avoid, there's no problem with if it's avoiding having an erection. There are plenty of medications that can help you decrease your or avoid for you having an erection. Due to the fact, Sam, most of erectile dysfunctions are caused sometimes by medications, long-standing medications, especially as what I mentioned before, medications for hypertension or cardiac problems. Also, medications for psychiatric or mental health problems can suppress or can give you a failure in erection. So, for your questions, yes, there are a lot of medications that are available to suppress the erection of the male. Those are usually uh, medications that for mental health. and cardiovascular medications. And as you know, we also have medications to help you achieve erections, which are we call your phosphodiesterase 5 inhibitors, or your very famous sildenafil, tadalafil, or your Viagra medications, right? So you can go both ways. Uh, Thanks to modern science, we have both medication that can suppress it. We have medications also that can help you achieve an erection.
Yes. And obviously, this is all dependent on a doctor's consultation and
Of
their
course,
under their professional opinion.
I won't encourage them to try it without any consultations first with a doctor.
Great. Awesome. Now, this is somewhat of actually, I've never heard this question before ever being asked in any of my human growth and development courses. So I'm uh, eager to hear the
Sure.
answer. But is it true that smoking can cause the penis to be short?
Not short, but it can make it flaccid and not prevent it from having an erection. Smoking can occlude our arteries and blood vessels, can give us problems in circulation. That's why I mentioned a while ago in the lecture, we need to have ample circulation to achieve an erection. So if you're a chronic smoker, you can have vascular problems. You know that one of the most potent etiologies or causes of cardiovascular problems, not only in respiratory problems, is smoking. It can do occlusions, it can decrease the blood supply. Hence, the male cannot achieve an erection eventually. Okay, so yes, it doesn't shorten the penis per se, but it will help, it will contribute for the male not to achieve an erection. So that's a proper terminology there from smoking. That's why I don't smoke some.
I think that's just an advice that everybody should follow in
Yeah,
general.
yeah, correct. I would
uh,
always tell my students that smoking is really bad for their health. Not only
right.
for their cardiovascular aspect of it or
Mhm,
respiratory aspect of it, but also
mhm.
in their reproductive health as well.
Mm. Actually, so there's a live question that just came in, and
Sure.
it's slightly related to what we've been talking, but it's talking about specifically Pfizer's Viagra medicine and
Yeah,
whether
yeah.
it has
Go
caused
ahead.
cardiovascular problems in
Okay.
men.
The history of it, Sam, is that Viagra or sildenafil was developed to cure angina because it causes dilations of the vessels, right? But accidentally, which is a good accident, it dilated a different vessel down there. So they market it as a erectile dysfunction drug. But those instances that it causes cardiovascular problem is that a person took it together with another cardiovascular drug or a anti-anginal drug, which further pushes down the pressure of that nail and cause cardiovascular problems. That's why one of the contraindications in taking Viagra is that you shouldn't have any cardiovascular problems, and you should not take it with another antihypertensive drug. So because it can potentiate in lowering down your blood pressure, which can go down to the level that is very dangerous for the male.
Okay, okay, makes
So
sense.
that's my answer for that. Medical supervision before you take it.
Always.
For those always, and for the question that it causes a heart attack or problem, that can happen if there's a pre-existing condition already. It is supposed to be a cardiovascular drug, an anti-anginal drug. It opens up the blood vessels, which is its main action for the erection of the male. But if the male has already a pre-existing condition, hypertension, blood problems, or even past stroke, we don't recommend it that they use it.
Hopefully that answered the live question.
Yeah, no
uh,
problem. Is it,
number
are they sure the Viagra caused the heart attack, or was the partner the one that causes the heart attack? They should be
I
clear about that, right?
I think, yeah, so they just mentioned, they asked whether Pfizer's Viagra has
Pfizer
caused
Viagra.
and any like
Uh,
general cardiovascular problems, not
the main side
necessarily.
effect, the main side effect that we always tell the patient that are using Viagra is they will experience definitely headache after it because of the dilation of the vasculature of the head and sometimes also nasal congestion. So that's the only side effect. But if you're healthy, but if you have, besides erectile dysfunction, but again, for my answer a while ago, if they have a pre-existing cardiovascular problem, it's not indicated for them to use it.
Awesome. Makes sense. This next question, I guess, is related to erectile dysfunction. It's asking
Sure.
whether prostate surgery has a
Mm.
cause. Is it like a cause and effect of ED?
Okay. Uh, the prostate surgery has an effect in fertility, not in erectile uh, or erection of the male. But there are certain surgeries that can damage nerves that can, what do you call this, desensitize the innervation to the penis. If it's, but if there's no complication and the surgery is successful, there shouldn't be any problem. But again, if you remove the prostate, uh, you cannot alkalize the semen of the male. Hence, it will be very difficult or they will become impotent and cannot further impregnate the but again, not prostate cancers. But the prostate cancers are usually caused by overstimulation or understimulation. That's the most common one because it is the pathway of ejaculation and orgasm for the male. So for my answer or my opinion regarding that, it doesn't affect the erection, but it affects if it's properly done. No nerves were cut or no cancer tissues affecting the nerves, but it does affect the fertility of the male.
Okay, all right. The next question is discussing something that is, I guess, two things that are very important in a youth's life, piercings and tattoos. How does that affect the
Oh.
male reproductive system? Or does it affect it at all?
Uh, Piercing where? My next question for that is where in particular?
Mm.
Or is it piercing any of the structures that we just mentioned during the lecture? Or it's just only skin deep of the male genital organ? For the tattoo, as long as it doesn't affect the pathway of the ejaculation, it has no problem. They can have a tattoo in the pubic area. But in the male sexual organs, it's very difficult to have a tattoo, especially in the penile area, in the head. I haven't encountered a male that has a tattoo in the head. But for those who are listening to us, please reach out to me if you do have one. Can you show it to me because I salute you because the head of the penis is very sensitive. That is the most sensitive area in the male reproductive organ. For them to have a tattoo there, they have a very high tolerance in pain. Okay, so does it affect sexuality? If it's only skin deep, no, and it doesn't obstruct any of the pathways that we just mentioned. Piercing in the urethra, no, but again, it's their preference, so no problem. If they have a tattoo on the arm, they're more cautious, or they should be more problematic from that side rather than the male reproductive organ. But if we're talking about piercings in the male genitalia, that depends on how deep the piercing will go, because that can be a site of infection in the future, especially when they do sexual intercourse and they engage
Interesting.
into
Okay.
sexual intercourse.
Yeah, I think this question pops up a lot, especially I've seen
Mm.
it if I'm ever donating blood or
Ah,
anything like
yeah.
if I'm ever donating blood, they'll ask, "Have you gotten a tattoo or a piercing in the past
Yeah.
12 months?" So I think in some sense in people's heads, it's a connection that you can make to the reproductive system as well.
Okay. Because if the tattoo came from a uh, un, unsanitized needle or unsanitized
Mm.
tattoo shop, it can transfer certain diseases or certain viral diseases or bacteria in our blood, and then it can be transferred to the person that we're donating to if we're doing a blood donation or blood transfusion. Now, probably that question also comes because, as you know, HIV and certain sexually transmitted disease are transmitted also to the needle and to the blood, like hepatitis B and other viruses, right? So just make sure if they get a tattoo, it's sanitized and uh, they can check their blood first for any virus for that after 6 months or they have their tattoo.
Okay. That's a good segue to actually a live question that we got. So
Mm.
wanting to know what the most prevalent STD in men is,
Oh,
and the role of men transmitting STDs to women.
well, because nowadays we are very careful with the this generation with the rise of sexual preference of male to male, or we call your homosexuals or LBTG, right? Before, when I was studying, most prevalent or the top threes are your gonorrhea, chlamydia, and even your syphilis. Those are prevalent, what do you call this, STDs. But the most common, if you ask me what's the most common, is still your E. coli infection. E. coli is a normal flora in the female anus, which sometimes can be transferred to the female by the penis. So, which is can increase their chances to have an infection in their vagina. So, for STD, that's another common. Uh, Gonorrhea is still prevalent. Uh, your chlamydia and syphilis. Remember, based on also our lecture a while ago, male, the male gender doesn't has usually uh, have a urinary tract infection, or it's not common for the male to have a urinary tract infection compared to the female. Because if you see the anatomy of the female, you have your vagina there, you have your uh, anal area, and on top of that, you have your urethra, which is around 4 centimeters only. Unlike for the male, we have a penile urethra, male membranous urethra, and prostatic urethra. What do I mean, or what I'm driving at, is that each time that we urinate, that pressure from the urine washes out any offending organism that tries to get inside the urethra of the male and go to our reproductive organs inside. For the female, it's very difficult or they are more prone because of the access of the normal flora in the vagina and in the anal area. So I always tell my students that if they encounter a male with a urinary tract infection, please try to investigate or at least try to take a history of it and try to correlate if it's a sexually transmitted one. Because for us, the urethra, every time that you urinate, it should serve a protective mechanism in washing away any foreign bacteria, virus that should come up in our reproductive organ. Now, uh, due to the preference of males now, there are certain numbers of rise in different viruses. As you've heard, here in the Philippines alone, the rate of HIV is increasing as well. Uh, what else? Your sorry. Besides syphilis, we have now your HPVs, your human papilloma viruses, which can cause cervical cancers for the female. Usually, it's only HPV2 in the groin area or the reproductive area. But nowadays, even and HPV1 is only confined in the oral mucosa. But nowadays, HPV1 and HPV2 can be both found in the groin or reproductive organs of the male and female. So there are increasing number of varieties in sexual practices. That's why we also see a number of rise of sexually transmitted diseases and exchangeable areas in those bacteria and viruses in the human body. So be careful every time uh, for those diseases. So again, just to recap, and answer that question. Prevalent still, your gonorrheas, chlamydias, and syphilis are still out there. But depending on the sexual preference of that male, you can investigate on E. coli from the anal area and HIV.
Got it. Now, this question is actually from my end. I
Sure.
took a long time ago, I took a class in biology, but it had to do with stress. So a lot of it covered how stressors, whether it's external or internal, can affect either the female and the male reproductive system. And I just wanted to jog my memory a little bit. Like, can you just give like a small spiel about how stressors can affect the hormones that are found in our pituitary glands?
Okay. Um, this is funny because every time that I lecture on endocrine glands, textbooks always describe the pituitary gland as the master endocrine gland. But if you have to remember, it follows one particular organ in our cortex, which is your hypothalamus. Our hypothalamus, even if it's only a pea-sized shaped gland in our brain, it functions or it is a gateway to the different functions of our cortex. Temperature, satiety, stress, blood levels. That's why my joke in my class, how can you be a master endocrine gland if you follow the hypothalamus? So we call the hypothalamus as the lord of the anterior pituitary. So being that said, functionally or physiologically, if you're stressed, it affects your hypothalamus. It affects also your anterior pituitary because, as you have learned a while ago, those signaling comes from our hypothalamus. So eventually, those releasing hormone or stimulating hormones are being manipulated. It can increase and decrease. For the female, as you probably most of our listeners here can experience, if they're stressed, their menstrual cycle can be prolonged or can be shortened, right? Studying for an exam,
Right.
stress
Yep.
or deadline. You're anticipating your menstrual cycle to come on the first week, then it can came early or it can came late. For the male, as what I mentioned a while ago, doing intercourse or we are tired or stressed, it plays an important role for us for having an erection or even an orgasm on some point. So it greatly affects stress, greatly affects also our sexual performance and reproductive system as well. Now, some people just belittle stress. That's just stress. You always keep on telling us stress. But if you come to think of it anatomically and physiologically, it's part of our brain. I failed to mention, I always start this lecture that telling my students that this is the reproductive system. But I still believe, as a medical doctor, that the brain is the biggest sexual organ of the male and the female.
I think that's a really good way to put it, considering how well connected everything in our body is.
Of
I would
course.
say.
That's the
Right.
power of the brain. Yeah.
Of course. So one final question to wrap everything up. It's a little bit
Sure.
prevalent to the times that we live in right now. So
Sure.
it's asking. There have been recent reports about COVID complications that affect the male reproductive system. Is that a fact? What's the truth to it?
Okay. Uh, COVID-19 binds to our body to what we call your ACE receptors. Your ACE receptors are found in different parts of our body, but it's mostly concentrated in our lungs and respiratory system, and even in our gastrointestinal tract. It has, but it doesn't have any plenty of receptors in the male reproductive area. But the problem
Mhm.
is, Sam, it affects our heart and pulmonary, which, as you have learned a while ago, can affect our circulation in that area as well. So, as what I mentioned, cardiovascular problems affects erection, and erection
Mhm.
affects cardiovascular system also. So, goes hand in hand. Now, if it's the virus causing an erectile dysfunction, no, it does not. But it can be a secondary cause or any viral infection or bacterial infection to have a problem in the reproductive area, not per se
Got it.
only erection. So
Okay.
that's my answer for that.
Okay. So it's like an indirect.
Indirect, probably an indirect, but not indirect. COVID-19 will, won't. If I contact, I have patients, male patients that have COVID-19. Of course, their body is weak. They cannot perform, definitely, but it doesn't affect their fertility or sexual performance after they recovered from COVID-19. It won't make them infertile, or it won't give them the next day or that week a erectile dysfunction problem, unless that they already have an underlying cardiovascular problem. So that's my answer for that.
Awesome. That was a fantastic Q&A. Again, I hope everybody got the opportunity to learn something new, even if you are an existing med student or you've studied biology or any sciences in the past. I hope you were able to learn something new, clear any misconceptions or any uh, misconceived notions you had in the past about the male reproductive system or male well-being in general.
Mm.
I want to make sure that whatever has been learned today is a good way of transmitting either information or educate all the men in your lives about their health, their well-being. And a very special thank you to Dr. Bautista for joining us today, all the way from the Philippines. Even with the whole time difference, he's done so much to help us out and be our voice today.
Welcome.
Thank you so much for being here. And Dr. Bautista, would you mind saying a quick hello to our viewers on YouTube as well? There's a different group of people there.
Hello, hello. I hope you learned something for today or contributed to your knowledge regarding the male reproductive health. Hi to
Awesome.
everybody.
Awesome. Thank you so much for that. Now I
Thank
understand
you.
that everybody has prior commitments and everything, so we will be ending our talk shortly. Do let us know, or do let Dr. Bautista know if you have any further questions for either related to whatever we discussed today or anything that we didn't get a chance to cover. Thank you for attending. As always, this event is available on our YouTube channel, our Facebook page, and I think clips will be eventually posted on Instagram at a later date. So you can DM us, you can message us, you can email us, and we look forward to continuing this series and are excited for everybody to take part in our future projects. And we're also excited to have Dr. Bautista with us on board and contribute with us through this organization and the work that we've been doing. So thank you for attending. And a last note for everybody who's here today, please continue to wear a mask, physical distance, sanitize, get vaccinated whenever it's available in your location so that, we can get back to going outside a little bit more frequently in the future. So stay safe, and we look forward to meeting you again soon. Dr. Bautista, if you have any final words, please feel free.
No, just thank you, and please try to get vaccinated, especially for my students and my uh, friends in India. I know it's a trying time. Please stay safe and healthy. Try to get the vaccine as early as possible so we can achieve your herd immunity. For whatever country that you're in, you're listening, COVID-19 is real. Uh, Try to be safe, not only for you, but also for your family members. That's it.
Awesome. Thank you, Dr. Bautista, once again for joining us today.
Thank you.
All right, everybody. Thank you for joining us. You are feel free to log off whenever you wish to.
Thank you.
Thank you.